Thank you, Mr. Speaker. I appreciate having the opportunity to review with the members of the House and also with other people watching one of the most important ailments of the country. And that is, there is today an asthma epidemic all across these United States. The rate of asthma in terms of its incidence and morbidity and mortality has been increasing each and every year. What we find here today is asthma in America has some numbers we all need to be aware of. 22 million people here in these United States suffer from symptoms of asthma. There are 4,000 deaths every year from people who have asthma that's totally out of control, under-medicated, and under-cared for. Too often today, patients suffer from allergic reactions not just in the nose and sinuses, which we call hay fever or allergic rhinitis, but also in the lungs, where we call it asthma. For asthma is nothing more than an allergic reaction within the lungs. $20 billion is what we spend every year treating and diagnosing this condition. We can and must do better. In terms of lost days of work, over 10 million days are lost because people are ill with their asthma symptoms, and 13 million school days are lost each and every year because children are underdiagnosed and undertreated with this important condition. We can and we must do better, and one way to do that is to guarantee that patients receive an accurate diagnosis. Recently, in the healthcare debate here in the House, much attention has been paid to primary care, or to the medical home model, where every citizen in the country would have a primary care physician to go to receive their medical care, not just for themselves, but for their members of their family as well. So how well are the primary care doctors doing when taking care of these asthma patients? In a number of double-blind, crossover-controlled studies, we find that asthma specialists have been delivering higher quality and lower costs for the care of these asthmatic patients. There's been a documented 95% reduction in hospitalization when taking a patient once hospitalized with asthma and then following the patients, whether they're referred to primary care or to an asthma specialist. A 95% reduction in hospitalization, a 77% reduction in visits to an emergency room, and a 77% reduction in days missed from work. Clearly, the evidence reveals that specialty care for the diagnosis and treatment and management of this chronic and often fatal disease is best handled by those who are specialists in the area. These facts have to be considered as we consider legislation that would compress people and not force people but guide them into primary care versus specialty care. Throughout the country, specialists and primary care physicians have been working hand in hand and need to collaborate and cooperate when caring for patients not just with asthma, but with all sorts of medical ailments. And now that we're on the subject of health care reform, there are three essential elements that must be in a piece of legislation to pass this House and the Senate and to be signed by the President. They include not only no discrimination against any citizen due to pre-existing conditions, but also transparency in the medical marketplace, where every entity, every individual or business entity that offers medical products or services for sale to the public should at all times openly disclose all of their prices and guarantee that everyone has an opportunity to know the price of a pill before they swallow it, to guarantee that everybody knows the price of a chest x-ray or any other medical procedure before they actually have that procedure done. Transparency, that sunshine that's needed to help create a medical marketplace is critically important. No discrimination against any citizen and complete transparency will help to create that medical marketplace, but we also need to develop a standard health benefit plan, one that will guarantee that if you are sick and covered by that standard benefit plan, you'll be in your house, not the poorhouse. A standard plan that each and every insurance company must offer to every citizen within regional markets to guarantee that a marketplace creates that competition to drive down prices immediately, not in 2013, but in early 2010. Asthma is an important condition. It's a very common condition, best managed by specialists who cooperate collaboratively with primary care physicians. As we go forward to reform our health care system, I hope that the House leadership will understand how important it is to collaborate between primary care and specialty care, and to guarantee that no discrimination, complete transparency in medical pricing, and the standard health benefit plan will exist in our legislation. And I yield back my time.